This episode is going to be really focused on mental health. I sit down with Chelsea Kading, who owns a therapy practice here in San Angelo. We cover various topics of just how to live your best life day to day with positive mental health, how to keep in check of your own mental health. We kind of dive into first responders, mental health specifically, how to combat burnout. And then lastly, we talk about the psychological aspects of sexual health, how to communicate with your partner. So watch along and I'll try and not make it an entire therapy session for myself. Can you introduce yourself and your background and what you do with everything?
What I do with everything. So Chelsea Kading, I've been a social worker for 19 years. Doesn't feel like it's been that long. So I started in psychology and just kind of kept getting one degree after another. Public health, psych, social work. I spent a lot of time in healthcare at the master's level. And then in mental health, probably the last 10 years. And decided to open my own practice for a little bit more what I thought was going to be flexibility in home life. But that whole business owner thing kind of kicked into that. But it's been a lot of fun. So I'm a clinical social work supervisor.
Okay. And
then I'm a national clinical supervisor for another company, kind of globally.
Oh, cool. Mm-hmm. So what do you all focus on here in town locally?
Really, if we have somebody that can see it, we will try to see people with whatever they come in with. If we know that it's something specific or they need a specific kind of modality, EMDR, I don't have anybody right now that's certified for EMDR, so we'll refer out on some of those cases. But we get a lot of anxiety, depression, couples, marriage. We get a lot of marriage and couples, I think. Okay. Right now kind of is at the top of
and it's primarily therapy focused, everything like that.
Yeah, it is therapy focused. We don't have an MP that is connected. We're connected with one out of Beaumont who will do psych and prescribe meds if they can't get into cool. Shannon or something like that. But he's not really with us. He's got his own thing. It's just a connection that we've made to try to get people seen a little bit faster if they need it.
I did a little episode with a psych NP, and it went well, but you're local, and really I think mental health needs as much exposure as we can, and so that's why I want to do a whole another episode focusing on mental health, but from the therapy aspect, because he had great info. From a clinician standpoint, we talk about meds more and everything, and from a therapy, I think is more kind of relatable and translatable across just to implement the lifestyle, how to, take care of things. But I kind of just want to start at the very basic, what is therapy and who can benefit from it?
That's a good question. Sometimes I like to start with what therapy isn't.
Okay.
And so, it's not, I think a lot of people will come in with an initial problem, let's say, which is great. That gives us a really good starting point. But it's like if you don't dig into that one thing, you end up kind of coming in, you're just kind of talking to a friend, and then it gets hard it's like, okay, what are we doing? It's not, people shouldn't be in therapy forever. Not to say it's not a lifelong journey, but you shouldn't be there for the next 2 years ongoing, unless there's something just really heavy. There are those cases, but they're not always. But usually, therapy starts with an event or something that happened, or even somebody who a lot of times with, a certain age range, maybe they haven't had insurance or haven't had the ability to seek therapy, and now they want to go back and kind of dive into their childhood, and that's fine also. But we start with kind of a big psychosocial to figure out what strengths and supports they have. We look at what their health diagnoses are, because that plays a big part into their mental health. And so there's a lot of information in that biopsychosocial that kind of gives us the information on what what do we need? Where do we go from here? What kind of needs to be the priority? How do we prioritize it? And so from there, we come up with a treatment plan. And that's kind of what a first session would look like. And then after that, we kind of start picking away at that treatment plan to dive into those things.
My kind of background from a clinician is, people coming to me, and it was primarily acute care things, urgent care, the emergency department. The emergency department's kind of on the end of things. They should have gotten therapy a long time ago, and now they're suicidal.
Crisis.
So, that's not really what I'm going to focus on today, but really on kind of healthy people wanting to stay healthy. I see a lot of even social media on it is always mental health check-ins and that kind of stuff. And what does that mean to you?
Yeah. So, we have people who maybe we've seen for a crisis in the past, but then, and I do the same thing. I have a therapist and, about every couple of months, I'll just kind of go in for a check-in because I think it keeps us grounded with, she's always, mine was really good about pulling up my list of things I said I was going to do over this couple of months. And did I do it? And so in those ways, when I say therapy, you shouldn't be in for 2 or 3 years. I mean, weekly for 2 or 3 years. But if you check in, I think it's awesome to check in every couple of months for as long as you possibly can. And it's that person that kind of can help you, hold you accountable. Maybe they got you through something that was, initial. And then now we just kind of, it really is kind of like a PCP checkup a little bit more frequently.
Okay.
And, setting goals there, therapists can kind of see and figure out based on behavior, kind of what's going on, you've gained weight, you've lost weight, you're not doing this, you're not doing that. And I think we can, do our best to kind of keep up with some of those things, as well as just a lot of people will come in every couple of months and they're like, I just really need to get that out of my chest. And they're good for another couple of months. Okay. And that's awesome. Yeah.
And so is it kind of scheduled or is it just an as needed or kind of both?
If it's a client we've seen kind of ongoing and they're at that point of just checking in, then usually, they'll just kind of reach out and say, hey, do you have anything, an appointment coming up? But there are people who prefer to schedule it. They like to know for the entire 12 months, I'm going to go on, the first Tuesday of the month. And that's fine too. We have the flexibility to do that, thankfully.
What do you think, or do you have any tips for clinicians to bring up mental health? Or, sometimes I've been able to tell that somebody is kind of struggling during the appointment, and one, time constraints of normal busy practices, it's hard to even want to dive into it. But two, sometimes I've been met with resistance on, like, I don't think this is my mental health, but I do think even if it wasn't, they brought up something that I felt that they could benefit from. Do you have any tips for clinicians on, one, maybe bringing up mental health, or two, how to direct or convince someone to seek further help, as in with therapy or anything? Yeah.
A lot of that is age-based, is, the younger population. I think it's a little bit easier when you say mental health. They're like, oh, yeah, because it's kind of a buzzword. But then you get to your mid-30s, 40s, and that's where the taboo comes in. And they're like, no, that's not it. This has to be something you can medicate. And clinic, doctors, NPs, y'all are busy and you see so many patients. You don't have the kind of time that we have, to spend with them. And I see that a lot and I think you have to rip the Band-Aid off, for one. The more often you bring it up, the more comfortable you become bringing it up. I don't know what your intake documents look like, but even if you have something on there that just kind of guides them to say, we're gonna check in on these things, because it does all play a factor. And from the opposite side, when I see men come in who are struggling with, libido or energy, or they've always been doing all these things and suddenly they're not, before I even suggest that they go to a psychiatrist, I'm like, you need to go get your testosterone checked first. Like, let's rule that out and then see what's really going on, because you have to kind of figure out which one it is. And so I think it's kind of the other way too. You can, if they're already in your office, then they've picked up on something is going on. And so they want it to be that. They don't want it to be me.
Right, yeah.
They much rather have it to be that. They do not want it to be me. But I think telling people, this is normal at this age. It's not uncommon. I see it all the time. You're not the first, you're not the last patient, that's going to have struggled with it, and give them all the resources that we can, not just mine, anybody. There are resources here if they can get into them, to get into them. But I think the more, just like when you're talking about sex and those things, initially it's like this, can I say that? But it's a part of life, and the more you talk about it, the more you become comfortable talking about it. But, I also know sometimes you get into that and it's like, oh gosh, I got to get to the next patient. Like, we got to cut this off at some point. You're not a therapist. And, you can say, I think maybe try this, see that, we can do all these things at once. That's how I sometimes phrase it to people, is like, let's tackle all of it together and see what makes you feel better. And with that over 30s age range, if you leave the word mental health out of it, it's almost like if you can just rephrase it, then they're a little bit more accepting. It's like, why don't you go it's just this person to check in with. And they're like, oh, okay, I guess so, And so sometimes they will follow through on it. Yeah, it's tough initially for clinicians to bring it up, especially if it's like not your wheelhouse, because you're almost afraid, like, God, don't say you're suicidal. Please don't say you're suicidal. You don't want to open that Pandora's box. But in my world, there are people whose baseline is suicidal. They live there, and we don't commit every single suicidal patient. But from a NP standpoint, that's a different world.
Right.
Yeah.
And so you've kind of alluded to this. And so luckily in my practice, I have changed it to where we do typically spend an hour with them. And so it helps, but it's still tough to cover everything, because my kind of main focus is medications, risk benefits, alternative treatments. But I do like to start with the lifestyle. And like my view of things is I want lifestyle to be like 75 to 80% of just your baseline, and hopefully it's a healthy one. I like to do 20% of that as hormones, throw in the last 5% as supplements, prescriptions, where we can't fill those gaps. But kind of from your standpoint on mental health lifestyle, what would that ideal, somebody who had the textbook perfect mental health lifestyle, what do you think that would look like in somebody?
I think, there's power and positivity for one. And then, do something to work out. A lot of people are in these jobs that make them very, sedentary. And so that gets easy to just stay that way. And then you go home and for whatever reason, you're emotionally, spent already from work. And so you're sedentary there. And so, you do sleep better. I have people who, I'll say, get a gym membership. You don't have to get an expensive gym membership. Just get a gym membership. Go walk the KOA. Do something to kind of move, to stay moving. And I think that's underused sometimes by clients. And so I think eating well, try not to eat a ton of junk food. Don't not eat. I'm one of the worst busy, just don't eat. This Red Bull's it for me. But even I feel better, if I plan meal prep. I think meal prepping is one thing that people could do that could improve a ton of stuff. If you meal prep, all you gotta do is grab it. That's it. All you have to do. Grab it out of the fridge, take it with you. It's already there. You're not at work trying to figure out what am I going to eat. And the best alternative or the quickest alternative is fast food. I hate fast food. My kids hate that I hate fast food. I just don't like it. So I got lucky in that way. But, meal prep, workout, and create a routine. If you don't create a routine in doing some of those things, then you're going to do it for a little bit and it's just going to crash and burn. It's helpful if you have somebody to do it with you, if like a good friend or your wife or your husband, and, can get everybody to kind of buy into it. But I would say those two things are at the top. Sleep. I see a ton of people who come in absolute crisis, and I'm like, when's the last time you had 8 hours of sleep? And they're like, huh? We have to sleep. Our brains have to stop at some point. And
do you have any tips for
sleeping?
For sleep specifically, just because that is something that is so crucial that everybody
it's over. Tough. Yeah. And they're just like, oh no, I'll burn it on
they'll do everything else, but and then neglect to sleep.
And then they're just like, oh yeah, I only sleep for 2 hours a day. I think first is cut off your, truly, just like we have to tell kids, cut your phone off. Quit scrolling. We doom scroll, in bed. Those things light up our brains. And so then here we go. And, before you know it, we're 2 hours in. We should have been asleep 2 hours ago. But truly, turn off your connections. Don't put a TV in your room. I know. Don't kill me over that. But try not to. Use the TV in the living room. The bedroom truly needs to be about sleep and sex. Mm-hmm. That's what it should be, and that improves also the other side of that, which is sex. You're not just sitting watching TV, and pretty soon you tire out, turn it off, and it's the same old routine. But sleep is so important, and turn things off. Turn your devices off. Don't watch TV. Some people are sleep better when they shower. I always say go to some of the natural things before, you start looking for things to force you to sleep. Melatonin is one, and sometimes routine helps sleep. Lots and lots of people who are bipolar can stay out of those manic episodes simply by, I have to go to bed at 10 p.m. I know I'm a grown person, but I still have to be in bed at 10 p.m. And I've seen people who can kind of slowly get off medications, and it comes down to routine and sleep. And if you can, and that's not all bipolar people, but if you can control someone with something like bipolar based on routine and sleep, we should learn from that.
Mm-hmm. Yeah, for sure.
We should learn from that.
And so kind of just with the testosterone improving, I went to a conference, is a Harvard testosterone and sexual health conference, and I was eating lunch, and the guy next to me, I was just casual conversation, was a psychiatrist, and I was like, "What made you come here? Just not a specialty I think would be there." And he was kind of really saying well, over the last couple of years, I've had guys start on testosterone, and I see them less and less, and they eventually drop off. And so I was just trying to get some more info just to see, what is going on. And then now that we've started doing women's hormones, progesterone, even in women, estradiol, progesterone, thyroid, testosterone, DHEA, they're all really good for mood and everything. But I think progesterone has stuck out the most in terms of, one, sleep for a woman, and it's just helped their mood, and they're sleeping like crazy. And we're just in this age where they're just so many progesterone deficient. It's not something that's talked about tons. Oral birth control binds it up, prevents it from doing it. PCOS, they have a luteal phase dysfunction where they don't make enough progesterone. And so we've been utilizing that a lot and have had really good success. Do y'all have any, or can y'all ever tell if somebody started hormones or recommend seek out for hormone optimization, and any benefits that y'all have seen on y'all's end?
Primarily in men, like you said, a lot, sometimes they'll come in and it's I can tell, not always, but it's like, this sounds very hormone. And I think for me, like, I spent so much time in healthcare that the first things I look at when they come in with depression and anxiety is hormones or thyroid. Those are kind of the top two, because those can look very much like depression. And so I always want them to do that. Keep up with your PCP, do those labs. Blood tells us a lot. It's the best we got sometimes. And, but I see people who it's like, if you can control some of those things, then we do see them less and less. And that's a good thing, but yeah, very much, very much.
I'm going to kind of switch into kind of a couple of specific populations of people. One, I just kind of want to hit, and you've kind of already touched on it as well, but it's, I'd say someone middle-aged, they've just been killing it for the last 20 years. They've got their education, they've been advancing, maybe they've now got a family, and then now they're kind of complacent, or they're still trying to grind, but now they're just wearing out. And it's tough to do everything, even if they come to me and I'm like, okay, are you exercising? Are you eating good? Are you sleeping good? And they're still having to just pour themselves into everything day to day. How does someone like that manage their mental health, or even notice if they're getting too far out of control?
Yeah, right. I think people around us notice probably before they do. That's one thing. And so pay attention and listen to those things. Also pay attention to your body. If you're getting to a point where you're not sleeping, or you're sleeping too much, and all you really want to do is go home and take a nap, then you're wearing down. Our bodies tell us it'll get what it needs. Your body will take it from you if you don't give it to it. And so pay attention to how you feel. And that's another thing with mental health is, people come in all the time and they're like, well, I don't really think I have this. Well, who cares if you have it? It doesn't matter what your diagnosis is. Focus on how you feel. And I think we have to listen to that and prioritize some of those things that we think we have to get done, all of it today. But in reality, some of those things are impossible to do all in one day. And so take them off the list, put them on tomorrow's list. But we're not good. I think people who have done, kind of like you said, they've grinded, they've been successful, they've done all the right things, and they've juggled the family, the house, all the stuff. And now it's just like we're against a wall and you're not prioritizing it quite well enough. And that's another thing therapy can help do, is help you sit down and, okay, what's on your list? All these things. Okay, well, this is easy. I mean, we could take that off. We can give that to somebody. We're not good at giving things to other people either, especially, grown people who have done it all. It's very hard to say, I'm not going to do this. I can't take this one. You've got to take it. And that's hard. I see that a lot in women in marriage, which ends up breaking down that marriage, which leads to a ton of other issues. They've always been able to do it. And then for whatever reason, life changes, job changes, more kids, less kids. They're just like, I can't do it. And they don't want to say, honey, I'm not doing this. You're going to take care of this now. And they continue spinning. And then the whole thing gets out of control. And that one, it's like we could have handed some of these things off, but we don't prioritize that sometimes. That's one thing, is what can you hand to somebody else realistically?
Yeah, I think that's good insight. The next is just kind of from a personal, from being in the ER. I've interacted with tons of police, ER nurses, firemen, paramedics. My dad was a paramedic for 30 years, so I've just kind of been in that forever. And those people are just kind of the most self-sacrificing people I know, and they almost never show anything, but they almost, I mean, I think it's getting better, but I almost never hear anybody actually even bringing things up or talking about or decompressing.
Mm-hmm.
Do you and your team have any tips or help manage these people? One, just from a personal thing, but two, from a, keep them in the game. I mean, we need these people to be in these positions forever.
Right.
And you typically go into it loving it, and then it just slowly chips away. But, do you have any tips on helping somebody stay in it longer? What do they need to check in on themselves, or what do you think would be best in helping them manage the day in and day out that they see?
Yeah. They see so much trauma. Just a ton. It's so across the board on some of the things that they see. And I think finding that neutral party, and that is where I think therapists can come in handy, is because you're not always dumping and trauma dumping on your friend or your spouse or things like that, because then you're truly kind of bringing that stuff home. And it's fine to have those conversations, right? Those are your safe people. But those are hard things to hear too, from the other side. And I think checking in with someone, whoever it is, as just, this is like our thing. We're going to check in on this and kind of get rid of it. I think that it's getting a little bit better with, first responders and things like that when it comes to mental health. I think where we're still kind of failing somewhat in society is people still are afraid. They're still afraid for their jobs. They're afraid their bosses are going to find out. They're afraid, people at their higher ups, the police department, the fire department, they don't want those things. They don't want to have to go, get called in and all of these things. And so we have to make sure that confidentiality, we got to leave people be, let them live their lives, because they have lives outside of what they're doing, their job. And, there's still a lot of, if you see a therapist, you're in some way broken. And that's just not the case. That's not the case at all. It's a part of the process.
I would say probably whenever I first started, that was kind of the thing to where, if you really need to talk about it or do anything, then you just don't need to be here. Then you're not going to make it. So don't even try.
Right.
And I think that turned off a lot of really good people pretty quick. And really, they could have made a huge impact for much longer if they could have, just been met more appropriately. And I do think you're right. I do think it's been talked about more. And so I do think they're starting to handle it better. But that was, 12 years ago. And I still don't think it's
not where it needs to be. No, it's not. I'll tell you, sometimes I end up seeing first responders as a result of a couple's. They come, their wife is literally dragging them in, and there's an issue there. And then it's, when you dig into it, it's like, okay, we got to fix this little piece first. And so sometimes you can kind of snatch them up like that and convince them. So wives, keep bringing those husbands in, I think it does sometimes come down to gender differences. I have more female nurses that reach out than I do male nurses. And I think there's an idea that it's like, well, if you can't hang in this field, you should, like you said, then you shouldn't be here. And that's just not true. There's a lot of things nobody knew they were signing up for. Right. They just wanted to help people. And so let them with the right resources,
Do you have any decompression tips or kind of nervous system regulation tips that are kind of like positive outlooks? I'll say, just kind of what my negative thing that I turned into was, honestly, I don't drink or do drugs or anything too bad, but I'd go home and eat till I fell asleep. So I guess that's kind of two-part. Do you have any binge eating tips? Because whenever I looked at that time, I was like, I meet the DSM-5 criteria for
binge eating.
Moderate binge eating. And then I
Probably
did
all
gain a
do.
lot of weight. And then now that kind of led to having a weight loss clinic and everything.
Yeah.
But it really stemmed from, that was my outlet from the emergency department.
Right.
And so do you have any tips in decompression and then maybe binge eating specifically if you have anything for that?
You know, first responders and healthcare are some of the most overweight people. And I think it's exactly that kind of thing. They don't have substance, often, not always, we're going to assume they don't have substance abuse and things like that. They're in the clear there. But, one thing with binge eating, regardless of what you do, is don't buy crap. If you buy crap, you're going to eat crap. If you only buy good stuff, you're going to eat good stuff, or you're going to be like, yeah, that's that mandarin orange just wasn't what I was going for, but I'm not willing to go to Walmart and buy a pack of Cinnabons. And so buy decent food to start with. That helps binge eating so much. So many people binge eat. And this helps some, but not all, but calorie counting. I know anytime I've been dieting on my own, it's like when I can see that number, I'm a numbers person. So if I can see it, then I'm like, oh, yikes. And so it's like that, being able to visualize it. So binge eating is so common. I think everybody at some point could have met the criteria there. And then, as far as kind of disconnecting and kind of calming your soul, meditation is underrated. How
do you start?
I meditate several times a day. And I think when people think of meditation, they think of this 30-minute, hour-long thing. It doesn't have to be. You can reset your nervous system with 5 minutes of meditation. And I'm a free fan. And so you can put into YouTube meditation, 5-minute meditation for anxiety, and it's gonna pull up a ton. People who don't know how to meditate need to start with guided meditation so that it tells you exactly what you're supposed to be doing. And if you do that consistently several times a day, you'll feel so much better. I do it in my office. It's not going to kill anyone if I am 5 minutes late because I need that moment to kind of stop everything. And meditation does that. It does that. And you can truly, YouTube is like the best place for meditation that I have found to give resources to clients because, one, it's free and you can put anything in it. Teens, meditation for, 10-minute meditation for bullying. It's there, and it's that voice that these kids, hear, and you can do it for, you name it. It's there. Yeah.
That's good to know. I've tried meditation a few times, and it is like a skill to even develop too, because it's tough. So the guided stuff is a very good.
Yeah, guided and then short. Start short, and then it's like once you're like, oh, that did make me feel better. Okay, now I do have 10 minutes, and you'd be surprised how much time we actually have if we just. It's like we always, especially like business owners, we think we have no time. It's like, I don't have time for that. I don't have time for that. I don't have time for that. We have to make time. We really do, because otherwise it all crumbles. And meditation is one of those things that you can do several times a day within the day for a short period of time. And it's a reset.
That's good to know. And yeah, YouTube's great insight just to try and find anything.
Anything. I changed my battery the other day in my car with YouTube. It's amazing.
That's awesome.
Yeah. Alternator, done.
Yeah. Kind of even switching gears again is as we, while we're sitting down with the lifestyle, talking about hormones typically have some sort of a sexual component to it. And so we talk about sex more than what I thought I would. And then also just over the years helping guys with testosterone, erections, libido, have a pretty significant psychological component, even premature ejaculation, delayed ejaculation, that kind of stuff. Do y'all work with anybody like that, or do you have any insight? I'll just focus on guys specifically in terms of erectile function and libido, and then we'll move to females next.
Yeah. So yes, I actually started out doing a lot of that. I was not here in this community, but I see more of those things from requests from people outside of San Angelo. I don't get a ton of that here, and I think some of that is our conservative Bible belts, which is fine. I think people are still, so even worse than mental health is we're going to go in and seek therapy because of erectile dysfunction. No one wants to do that. No one wants to do that. My tip for those people is just don't tell us that's why you're coming. It's fine. It's fine. We can be a secret until you get there.
Yeah.
You don't have to tell anybody. But it is so common. It's very, very common. And sometimes it started with something, it started with a bad relationship or, a one time that happened. And now it's like, that's the only thing they can focus on in the moment. And it hits them every time. And there are some pretty decent, there's some research out there for EMDR, which is the eye movement for that. And we were working on our certification there, but that is one that they've started to kind of see. It's one of those they've kind of pulled that out of the box to kind of see if it helps. That's one, especially for their kind of performance anxiety. That's what it kind of sometimes comes down to is anxiety. And then another issue, especially if you've been married for 15 or 20 years, the reality here is that you've done the same thing for a very long time. Change it up. Do something different. And sometimes that can be helpful, for men on that side.
Yeah. A few times, or most of the time, even in a young guy, I'm still going to give them meds because the meds work very well.
Yeah.
And the meds can then restore their confidence.
Right. Yes.
And then they won't even need them later on once they kind of get that back and everything.
Yeah.
But yeah, sometimes it's like
getting over that hump of, no, that's just one I definitely am like, that one, just go fix it now. And then we keep working through it, but they do. That's not, it's not pleasant for anyone. And it does need like a quick fix this.
And sometimes it stems from like one comment one girlfriend said a long time ago.
Yeah. Junior high. Yeah. It's like, really?
Yeah.
You don't even know this girl anymore.
Yeah. And so some have used an app like Mojo, and that's what even really got me into looking into it. But, sometimes it's that they can't focus enough and then they lose the erection. And then sometimes they're too tense and then sometimes either they're too focused on it and then they, can't last long or they last too long or, and so anyways, I do think it has there's more of a psychological component that people give it. I think in a lot of times.
Yeah, there's a big psychological component. And those are hard to sometimes get in and convince that there is a psychological component to it. But yeah, a lot of times it's something that they've carried with them.
And then women is kind of a different thing. I will say most of the kind of sexual talks I'm having with women or one of the other nurse practitioners is that they're, we do use meds for women. They're getting more. Medical research is very sexist on that it is not woman-based. And
right.
So they're just now really getting more things like bermanilitide for hyposexual desire disorder is really good that they can do an injection. So we'll do that at times. Testosterone optimization for women has been awesome in getting their kind of libido and just feeling good about themselves back. But sometimes they do have pain or, again, something else from a previous relationship that, now they're in a healthy relationship, but they're still not wanting to have the libido or the desire, even though they love their partner as much as they want.
Mm-hmm.
Do you have any tips for them or how to approach those situations?
Yeah, we see a lot of those. One, if it's physical pain, the first place I say go make sure you're good with the gynecologist, that there's nothing else going on.
No woman should be denied vaginal estrogen.
Absolutely.
Just breast cancer, strokes, that kind of stuff. Vaginal estrogen is still safe and would help a lot of these women as well. That's just one little thing.
Yes, and I will say, like you said, it's a sexist. I know, it's something that I hear it all the time from women because I do. I'm like, you need to make sure you're good with your doctor. They'll go to their doctor and they're just like, they said there really wasn't any point in doing any hormone testing. And I'm like, okay. I mean, I can't argue with that. I'm not a physician, but it just feels like there could be something that, because it's consistent. I see it all the time with women. And then from the psychological side, turmoil in your relationship, like get your relationship on good, solid ground and then start kind of building those blocks again. The thing is, people who have been in long-term marriages have changed. They've changed. They've grown in different ways. They've, educationally, their own mental health. They've been on a journey. They just were on this journey with someone else. And so I think they're afraid of maybe that change. And you have to be open, you have to be able to talk to your partner about that. And sometimes if there are cracks in that foundation, we got to fix that. We got to cement those over and then kind of keep going. And then, I think there are women who just feel like they can't keep up with, men's desire. And I think that women are harder on ourselves than men are on us. And that even going back to body image, I think we are way harder on ourselves and our curves and all the things that we have than men ever are on us. And sometimes we have to really talk through that in therapy. Like, you're supposed to change. Like, you have given this man 4 kids.
Right. Yeah.
You didn't think you were going to look like you were in high school. Like, they knew this, but it's hard for us. It's that perfectionism of, that kind of thing. And then it does, people carry body image issues. Women specifically carry a lot of body image issues into the bedroom, and that sometimes kills kind of what's going on. And then it becomes maintenance sex is what it is. And once you get to that kind of indifferent, just maintenance sex, it's going downhill. Stop it before it gets there, because pretty soon it's going to be no sex. And then you've got a really big issue. It's a huge part of a relationship. It just is. Yeah.
And communication is tough in that context, but crucial at the same time from a guy and a girl, just from them to communicate. And then kind of where we have been coming in from like a hormone standpoint and everything is like, do you want your sexual desire to increase? And is it a problem where it's at? Like realistically, if a woman, if their partner's sexual desire is daily, but a woman is like, I just want it twice a week, but let me backtrack. I only want it twice a week, but I want it to get more, then we'll work on it. But if it's not distressing, like they only want it twice a week, then we don't need to harp on it. But that's just something to communicate from the partners, realistic goals and expectations. And if they feel neglected, where can the partner come in and help and hopefully feel that as well.
Yeah. And I think women also struggle with that at the end of the day, just pure exhaustion. We've just done all these things just like men have. It's just gender roles are just different. And it's that I just want to go to bed. I just want to lay down. I want to watch TV. Again, keep the TV out of the bedroom. It's my biggest suggestion for marriages is keep the TV out. and the kids. Keep the kids out of your bed. Don't do it. Don't make that mistake. But it's just that exhaustion. And I think there are some things that could be improved there, hormone related, because
that's where we come in and hopefully help you just feel better day to day. You have the drive, the energy to even want to interact with your partner.
I didn't know y'all were doing female, women.
It's been a very recent thing, and I wasn't.
Which is awesome.
Yeah, I wasn't announcing it much.
Oh, whoops.
No, we just did. Yeah, we just did publicly announced it this week. Mm-hmm. I've been getting training for a year and a half now, just kind of in the background. I mean, I was primarily weight loss focused, and then I just kept having to say, hey, go. I think you need your hormones optimized, but I don't do that. Go to somebody else. And being a guy, I was learning, but I was like, I need kind of some females to help. And now I have 2 female nurse practitioners just to really help have a face. And we all collaborate on all of them. And they've been getting tons of training and everything through various aspects. I don't like just one form of training. I like to get 5 different views and then your own anecdotal experiences. And so that's where I think we'll do well is each nurse practitioner has 8 years of NP experience on top of all this newfound hormone optimization stuff. So anyways.
Yeah, that's awesome.
I think we'll do good. And I'm happy to extend that to women finally and not say, like, hey, will you go somewhere else? And then they're met, with their OB on kind of like, no, I think you'll be okay.
Yeah. Or the insurance isn't going to pay for it. So why go down that, which is often the case,
It is
insurance isn't, they're going to pay for Viagra, but they are not going to pay for, for a pill for women.
Even
it's just not.
The FDA approved stuff, Vyleesi and Addy are kind of the newer things. And they're expensive. I'll even get Bromanolitide, which is generic Vyleesi from a compounding pharmacy to make it more cost effective.
Yeah.
And
those are even some of those, typically I can find any medication for free somehow. Yeah, I'll go to the pharmaceutical.
Your social work background.
That's what I do.
Yeah.
And but even, it's those, it's crazy to me. I can go to the manufacturer and get Viagra for free for a man for 12 months. And I cannot get one single bottle for women. And I hate that.
And I'm hoping the WHI was a study done 20 years ago that really set negative towards a lot of the female hormone. And I'm thinking it's starting to undo itself, but I think there's still a long ways to go. I mean, we have the studies now to show they're safe, but it is just trying to undo 20 years of everything. Yeah. So it is, even from a clinician standpoint, kind of nerve-wracking on our end to go against the grain a little bit.
Right.
But it is at a point where it's needed. Women's health has lagged, and
the only research we need is divorce rates.
Yeah.
I mean, are we,
and when that happens,
we say we're trying to fix this, that we say that we're working on divorce rates, but we're not really getting to the root of it. Like it's a big issue in relationships, and it's the number one thing I see people in therapy initially for.
So overall, that was a lot of kind of hard hitting topics that I brought up. Do you have anything that you want to bring up or kind of close with?
I don't. I guess maybe if you want to do some MythBusters.
Okay.
Like women, I've had women come in and be like, oh, my husband started testosterone and now he's angry. Yeah. Is that a thing?
So, yes and no.
Okay.
Depends on how managed they are. I will say from my standpoint, if a guy is super moody and agitated and I put him on testosterone, his mood improves a lot of the time.
Okay.
Because he now feels better. He can now handle those situations. But there is a threshold. If he's getting it from his gym bro and his gym bro is going to tell him to take 2 to 3 times more than he actually needs. I mean, testosterone replacement doses are pretty minuscule compared to gym bro doses. And so
gym bro doses.
Yes.
I like that.
And so I do see their moods typically improve. if they're on too far the other end, then they can be a little bit more on edge, and then we back them down a little bit or do smaller, more frequent dosing. Sometimes it's the same total weekly dose, but their mood is much more stable in that way. So yeah, that's a good question though.
Yeah, I get that a lot. Women are like, oh, wish you'd never started this.
Yeah, no, as long as they're managed appropriately, I typically only see it improve. And I've had women at their follow-up appointments or wives say like, yes, he is much more easy to deal with these days. And he's just like, oh, I finally feel good, you know? And it's just kind of like, that's kind of the driving factor is that he's just revving that engine all the time. The testosterone helps fill that tank. And so he can take a breath, deal with it. He has more energy at the end of the day to be involved, and he's not just on autopilot or sinking into the couches and stuff. And so that's what we do. Yeah, that's really the biggest myth is that I was trying to figure out, like, is it, because I don't know. It's a new thing even for me. Like, I know enough to say, go check it. Like, this sounds like it could be an issue, but that's where my knowledge about it stops. Sure, yeah.
And so I'm always trying to learn more because it affects my clients too. So.
How can people contact you to set up with your team?
Best way is to go through our website.
Okay.
So Village Therapy. You can just put in Village Therapy San Angelo. It's going to pop right up.
Okay.
And there's a link there to be able. You can book directly. You can give us a call. I'll say calling is the least best way to get a hold of us because we're in session.
Right.
You know, we're in session all the time. I have several providers, have some with same day availability. I do not have same day availability, but I have others who do. And so we can get people in if we need to. And then, of course, we can also connect them with other resources. If we can't meet their need and they need something different, we'll get them, try to connect them with people who do.
Okay. Well, cool.
Yep.
Anything else before we wrap up here?
I don't think so. It's
awesome.
been
Well,
fun.
thanks for your time.
Thanks
for coming in.
This was fun.
Yeah, this was good. Thanks for tuning in. If you like this, like, comment, subscribe. Of course, reach out with any suggestions for content in the future. I love talking about anything health-related, lifestyle. If you have any specific topics you want us to cover, comment here, email liveoaktestosterone@gmail.com, and look forward to more. Thanks for tuning in.